Hali yangu nilijua 97 mwezi wa 10, lakini nilikuwa na shida yani kwa mwili sana. Ndiyo ilifanya niende nijue nini na nisumbua kila siku mimi nalala, Ilibidi niende nijijue, alafu nipimwe. Nilisema wanipime nijue kama ni ugonjwa ipatikane. Wakaniuliza ukipatikana na ugonjwa atasema. Nikasema si mimi mwenyewe nimekuja nijipime, nianze madawa.
For starters, we usually give them a combination of lamivudine, stavudine, one in the morning, and a combination of this also, which they take one in the evening. They're given for 15 days, and when they come back, they're reviewed, and if their CD4 levels are okay, then they can be continued on this for 1-2 times a day for 30 days or 60 days, depending on how their progress is.
Here in this clinic, we have CD4s for every patient baseline, and then from after the baseline, we have CD4s which are done every 6 months. So when we get your CD4 results, we look at the previous CD4s, how they have been. So if there's a drop, we calculate the percentage. If the drop is too big, we would repeat the CD4 immediately to see if maybe there was a problem with our machine. And if we confirm that actually the CD4 is still dropping, then we'd try to explore why is it dropping. Yeah, because what we really want is for the CD4 to go up.
Once we organize treatment literacy, you find everybody wants to come, and we can't afford. We cannot manage because we can't accommodate them in the first place, and of course resources are also limited.
Basically what we do is we get the file from the reception, and then we go through the file. We want to look at the notes to see what was done the last time the patient was here. Then from the notes you'll be able to know what the clinician planned for the next visit. Like there are times when you'll find the clinician planned for a CD4, any blood test to be done, urine test, depending on the regimen the patient is on. So we make sure that we implement what the clinician wrote the past time that the patient was seen. Then apart from that, you also ask the patient how the patient has been, because we know some of these drugs have side effects. So we want to know how the patient has been during the time when the patient was away. So if the patient has a problem, you decide where the patient will be seen. If the patient is very sick, the patient needs to be seen by the clinician immediately. So that is a patient who you'll have to see within the next 1 to 2 minutes at most. So if the patient is stable, the patient has no complaint at all, has been taking the ARVs well, what you'll do is you'll send this patient to what we call fast track. And in fast track, the patient will be seen by a trained nurse who knows a lot about HIV management, can treat minor illnesses. So in fast track, they take around 10 minutes at most. The patient is done a quick head-to-toe examination, and a refill is given.
My job as a counselor entails, one, to support all the patients or clients, we normally call them clients, who pass through our clinic. One, our clinic, as you understood, deals with patients living with HIV/AIDS. Most of the patients who come have recently learned about their status. And as you know, HIV is a very stigmatized disease. They need support, first of all, to accept themselves, to be able to go through what the clinic requires of them to follow treatment.
Bado nimefurahi mpaka wa leo. Hizo dawa imenilinda na niko mzuri. Bado nitakaa mwaka hata 70. Tata wajuku na wajuku.